All right, Ellen, thank you so much for being a guest on the podcast today. I'm so excited to interview you on everything regarding detoxification, including what's going on with the recent fires, and just be able to dive into all the stuff that you love to do supporting your patients.
Great. I'm excited. Thank you so much for having me. I'm a big follower of your podcast and I've learned a lot from it.
Oh, that's so nice to hear. Thank you. And for those of you that don't know, Dr. Ellen and I are actually very close friends, and we started working together. We met working together at a water fasting clinic up in Santa Rosa, California, where she now actually works as a naturopathic doctor at a clinic that's adjacent to that facility and does incredible work there. So we're going to be diving into all this amazing information. So, Ellen, I would love for you to start with just telling us like your story and your background. So what made you like choose the path of naturopathic medicine, and what ultimately led you to wanting to focus on detoxification and women's health in your clinic?
Great. Okay. So it all started when I was very little and I was sick and I didn't know why. And the doctors put me on a bunch of medications to suppress the symptoms and they went away, but I kept getting sick in other ways. And so that made me really question what was happening to me, especially at a young age. And as I got older, I knew I wanted to be some sort of healthcare worker, whether it was nutrition or PT or MD. And when I was in college, I studied abroad in South America and learned from some healers, some herbalists, and I saw them helping people with stage 4 cancer, all with herbs and fasting. And I decided then that I didn't want to go the conventional route. I wanted to find the root cause of issues and really trust the body's ability to heal itself. And in order to do that, I figured out that naturopathic medicine would be my path versus becoming a traditional practitioner or conventional practitioner. And, it circled back to when I was sick in the beginning. If I would have just known that the root cause was a dairy intolerance versus, taking all these pills, I would have gotten healthier much faster. So yeah, that's sort of how it all started.
That's amazing. And what kind of got you really interested in focusing on like detoxification, environmental chemicals, and women's health?
Good explanation. Really, it came down to the fact that to find the root cause of disease, if you can get rid of things that are burdening the body, your body can heal itself. So no matter what's causing, your headaches or menstrual issues, if you can get rid of the body's burden of detoxing constantly, then the body says, hey, I can heal this on my own. I don't need to, focus on all these other things because I can focus on my heavy menses. But when it's constantly filtering, it's putting all its energy towards detox. It doesn't have time to deal with the other underlying symptoms.
Yes, definitely. I always say to all the clients that I work with that our bodies like have the blueprint to heal. It's just a matter of getting those things that are burdening the body like out of the way.
Out.
And then the body just has this natural ability to be able to heal itself. So I love that you mentioned that. So what are some of the symptoms then that you see present in someone dealing with like an inefficiency to clear that toxic burden that they may be under in your clinic?
Good question. Really, it depends on the toxin, right? Toxin symptoms could be general, like fatigue, brain fog, headaches. But, if we're talking about estrogenic compounds like mycotoxins, which I know you talk a lot about on this podcast, or, endocrine disruptors like BPA, then you're going to have a lot of the estrogenic symptoms in women. So heavy menses, very crampy, headaches, mood swings. That's what you see with the estrogenic compounds. And then more of the like VOCs, so volatile organic compounds, that's the headaches, more of the pounding headache, and that's the almost hangover feel, right? Because your liver is trying to process all of this and get it out, just as it would alcohol. So it kind of depends. You have to piece together the symptoms, but really a variety, as you know, of symptoms can come from detox. Yeah.
Yes. And so, what are some of the most common environmental chemicals or toxins that you typically find overburdening your patients in your clinic? Like, what are some of the ones that maybe you see over and over again that you end up working mostly with?
So we see a lot of cancer. My residency was specifically breast cancer and firefighters, kind of a random combination, but we did some studies during that year of what toxins were the highest in those cancer and firefighter patients. And specifically for the cancer patients, this is again breast cancer, all types. Number one was ochratoxin A, which is a mycotoxin. Now, I live in Petaluma, California, where there's a huge, coastal moisture breeze constantly. So there's a lot of humidity in the air causing mold growth. So that could be part of it. But ochratoxin A was number one, then BPA, so plastic, right? And then glyphosate, which is Roundup. And that was specifically for breast cancer. So what we do with those patients, we detox them, get them out, and a lot of times they're able to heal their symptoms and reverse their cancer progression, which is awesome. And then for the firefighters, we did a similar study seeing what was the top toxins in them, and they had PFAS, which is what's hot and topic right now, those water resistant chemicals. Um, they were number one, and now they're dealing with tons of water resistant chemicals because they're firefighters. But they have been linked to glioblastomas, all sorts of leukemias, lymphomas. So scary, scary toxins that we want out of people. That was number one in firefighters. Then we had the mold. Okay, so again, I don't remember which mold, if it was ochratoxin or if it was aflatoxin. It was one of those two, but mold mycotoxins were up there too. And I suspect that is from their moldy living situations because their fire stations are actually not very clean. So that's interesting. And then number three for them was plastic. So they got plastic in them too. Everyone's got plastic in them. Yeah, those are the top ones for my most of my patient load. Then with women's health, that's a whole nother, that's all over the board. But I haven't found any trends with them, but definitely trends in breast cancer patients and firefighters.
Wow, thank you for sharing that. Let's dive into maybe some of the like treatment regimens that you'll do for your patients. Let's start with mold maybe. So ochratoxin A, like when you're working with your patients, whether it's breast cancer patients or it's firefighters or even anyone else that's just been exposed like in their home, what are some of the steps and supports that you like to take to help in starting to detoxify their bodies?
Yes, so this is something I really want to point out to people. Number one is removal of exposure. I have detoxed many people and they get sick again and again, and it's so sad because they have to pay and do the whole process when really they have to get out of the environment. And I'm sure you've seen this in your practice and with other practitioners. Number one, and I know it's hard, a lot of times it means selling your house, moving, but that is key to getting better, is getting out. But along those lines, you can take binders, which I know you've done deep dives into which types of binders for which molds, but binders are helpful no matter what, no matter where you are. Sauna, sweating out those toxins is helpful. Movement, lymphatic work. And then specifically in my practice, which is a huge part of it, is IV glutathione, right? So glutathione has a really strong sulfur bond. It's going to bind onto those mycotoxins and help your liver flush it out. IV versus oral, much faster, stronger, and it's going to get things out quicker. So sometimes it's too much for people, but if they're in the right state, then we do lots of IV and lots of oral in addition to binders. And then, of course, all the lifestyle stuff I talked about with the sauna and binders.
I always tell people to avoidance, avoidance, avoidance. Like that is like the biggest thing when it comes to the mold toxins. Like you can make some headway with supporting someone's body and at least just starting to decrease a little bit of the load. But ultimately, if they're still getting exposed, it's just going to continue to fill that bucket up and then make them sick again. So I'm so happy that that's the first thing you said. When it comes to sauna work, do you prefer like traditional sauna versus infrared sauna? Like, do you have a preference or does it not matter?
I've done this deep dive of like what's optimal, especially for mold toxins. Like, how are we going to get it out the best? What I've learned is sweating is the answer. So no matter how you sweat, what type of sauna you have, like the actual mycotoxins and the VOCs, those are all coming out through your sweat. So I don't even care anymore with patients. I just tell them sweat. I love the infrared too, because you can get, a little deeper into the body, but really just sweating is key. And then I always tell them to take a towel and make sure when the sweat's coming out, you're toweling off. Otherwise, it's going to reabsorb.
Yeah, I love that. When you're using IV glutathione, how many times would you say, like with somebody that has mold toxicity, are you potentially, how many sessions is somebody maybe utilizing? I know it's probably different. Do you have like a range of how often they might need those sessions of IV glutathione to support in detoxing their body?
Yes. So it does vary, as you're saying, like how well do they detox? How much of the lifestyle modalities are they using to detox? But typically, if somebody has got a high range, meaning a 95th percentile of mycotoxin in them, we'll do 8 rounds, 1 IV a week, plus they're doing daily oral glutathione and taking binders daily and some detox support like selenium, the basic minerals to support too. So generally 8 weeks, so about a 2 month process. And then if we'll retest them, if they're still high due to exposure or slow detox, then we'll do another round of 8. And then typically that's plenty to get rid of everything.
That's amazing. So how does the process then look for those firefighters that you're working with that are exposed to those PFAS chemicals that's in like the gear they're wearing and all that stuff?
Yeah,
So
what they're spraying.
yeah, what they're spraying. So what's kind of the detoxification process look like for that and supporting them? Because, so many people are getting exposed to those just in like camping gear, like you mentioned, water resistant gear we're wearing, the cooking tools that we're using with the nonstick cook pans, all that kind of stuff. So there's so many routes of, yes, furniture. There's so many routes of exposure. So what's kind of like the supports that you like to utilize for that?
That's a great question because unless somebody wants to, show me, we have not in our clinic found anywhere proof to get PFAS out, like any really good studies. So what we do in our clinic is, we know that sweating helps no matter what with all chemicals. When we were doing research with the firefighters, we did see PFAS come down with our typical glutathione detox. So we know that with liver support, we can get them down. We got, I think that the range was like within the 85th percentile of decrease, which is awesome. But you can also look at biochemistry. So if you look at a PFA, right, there's a lot of fluorinated groups on them. So that's the F that sticks out on the side. That's going to affect, thyroid, things that absorb fluorine, right, or iodine. But my point of the biochemistry is if we can find a substance that looks similar, it can displace those PFAS in the body and help them dislodge and process. So if you look at a periodic table, fluorine is in, one of the last aisles. So you look at the minerals or the elements that are on the same column and you can try that. So we've tried iodine, right? Iodine might help as well. Chlorine, which we don't try, but you can look at that. And if you can give a dose of that, you can help dislodge some of the PFAS in the body. We haven't had any research. We've just kind of experimentally done it with ourselves more than anything. And some people who are willing to try it, it's safe, so it's not harmful. But you just got to be careful with what you experiment with. But we have had success with high doses of iodine, just because it can dislodge that fluorine group. But for our studies, we're just sticking with glutathione for now.
That's so great to hear. And yeah, that's the thing too with those PFAS chemicals. The half-life is just years. They just stick in the environment for long periods of time. Same with our bodies. So that's really amazing to hear that in your clinic, you're finding ways to at least start to like lower the amounts that might be present in someone's body, utilizing some of the techniques. That's so cool. So Love to hear that. My last question around some of the chemical toxic exposures that you were talking about that you find in your clinic is plastics. So obviously exposure, I mean, avoidance and like starting to use more glass, stainless steel, all that stuff's really important. Is there other things that you recommend for your clients with or that you usually utilize in your clinic to help decrease what levels might be present in them?
Yes, my favorite and probably your favorite too, sprouts, right? With broccoli sprouts specifically. Um, Anything with the sulfur groups are really going to help with the plastic detox. We use particularly DIM, DIN, which is just an extract of broccoli, right? That you can really high dose it. I've had so much success with fertility with DIM, simple DIM, and lots of cruciferous, right? Cruciferous veggies. If you load that up, you're going to clear out that plastic. Of course, we're doing sweating as well to get it out through the pores, but DIM really helps dislodge the plastics or detox the plastics, supports the liver, and helps with removal of it and fertility and, lots of symptoms that come from excessive plastic, unfortunately. And I do want to note real quickly too, going back to biochemistry, how do we know what's, causing issues on our endocrine system? Like people say, oh, plastics are endocrine disruptors. If you look at the molecule of plastic, so BPA, you'll see there's a circle, which is called a benzene, and then an OH group on the end. So any molecule that has the benzene, the circle, and an OH group is going to mimic estrogen and cause problems on our endocrine system. So people are like, I wonder if, BPS versus BPA is problematic. Look at the molecule. If it looks like estrogen, it's problematic. So that's like an easy thing for people to check because it gets kind of confusing. But if you just look at the molecules and they're similar, they're problematic.
I really love that you touched on that because that's just a marketing tactic that a lot of companies use for saying it's BPA free, but there's like BPI, BPF, and we're starting to see that those are just as toxic to our bodies as BPA, just another form of that bisphenol, but you're bringing it back to just the biochemistry of it. And it just looks like estrogen. Most naturally, it's probably going to be mimicking it. So
yeah. And if it looks like a PFA, it's probably going to act like a PFA.
Yeah. Yeah, exactly. So I actually lied. There's one more question I have regarding one of the chemicals that you're talking about.
Oh, yeah.
So VOCs. Let's chat about that. Talk about like some routes of exposure people might have to VOCs in their home. And then you mentioned sweating that helps with detoxification of VOCs, but is there any other supports too?
I'm not as up to date as I wish I was on the VOCs, but I do know like solvents. I've had a lot of patients who are like plumbers or working with just solvents in their garage or in the house that have been problematic on their health, especially like skin issues and headaches. I wish I had better sourcing for you for that, but I can tell you that the best thing because of the polarity of VOCs is, in my experience, glutathione. Glutathione has that charge to bind out a lot of those VOCs.
Yeah, glutathione's amazing, master antioxidant.
Yeah.
Awesome. So now that we kind of touched into all these different ones that you see and ways you like to support your patients with it, what are some of the testing methods then that you like to use or labs that help to identify the levels that these can be present in your patients?
Yeah, so we strictly use Vibrant America as our labs. I'm sure there's lots of good other labs out there, and I know there are because I've seen patients come in with them, but Vibrant America has been the best for us, and it's standardized for us, so that's what I mostly know. But they have a total tox test, so it has over 100 different toxins, specifically mycotoxin, environmental toxin, PFAS that you can test, and PFAS and heavy metals that you can test for. So we use that on almost every single one of our patients. So that's my most used test.
I love that test. How often are you finding levels of lead, cadmium, mercury in your patients with heavy metals?
Lead I haven't seen in a while. Sometimes people who had like lead paint, I'll see. Cadmium probably comes up in like 5 to 10%. What else did you ask heavy metal wise? Lead, cadmium. Oh,
Lead, cadmium,
mercury.
mercury.
Mercury is a high one. I think, especially in our area, so many people eat a lot of raw tuna and seafood. So I'm, assuming for the most part that's their source. Um, and if you have a level above one, then, we really try to get it out. But most, I would say like 30% of patients have mercury above that. So we have to get that out, help get that out of them. But mhm.
Oh, how do you support detoxification of mercury? What's some of the supports you've seen work well?
We always start with, you know, supporting the body. So the sauna, the glutathione, our typical 8-week detox, and then we'll retest. If it's still high, then we'll chelate, right? So EDTA, and that's either oral or IV, depending on how high it is. But I will say that I really try to avoid chelation just because of how intense it can be on the body, on the kidneys, really, and liver. And detoxing, the 8 weeks detox, usually I would say 99% of the time gets it out of the system.
Awesome. Thank you. Thank you for explaining all that. So I'd love to take a little bit of a turn now, and we discuss a lot of the things that you see in your clinic and ways that you love to support your patients with that. But let's talk about the recent fires that have been going on in LA, which are so, so sad. But really want to talk about like what is in the air quality that we should be worried about, and like how could that be affecting somebody? Because I know the air quality index really tells us like half the story. So what are you typically worried about probably when you're seeing this happening currently?
Yeah, my heart really goes out to people in LA and everyone affected by the smoke because it's everything that you see in a house, electronics, couches, wood, everything is just in the air now. And you can only measure half of it. And like you were saying, the air quality, the index only measures like, a small proportion of it. So we don't really know how toxic everything is that we're breathing in. Um, So I would say, the best thing that we can do is get an air filter, stay indoors, sweat if you can, and, even making a box filter, which is, simply just getting a box fan and attaching a filter on the side that sucks in air and filtering your air inside. That's great. That's going to be super helpful. Um, but also, trust your liver. Do a lot of liver support. We have livers for a reason. Drink some milk thistle tea. Eat some cruciferous veggies. That's all going to help. And the human body is resilient. It's very daunting to see these fires, but we've had fires for a long time and exposures, and people make it through. It's just important that we're doing our best to filter the air, sweat, stay indoors, hydrate, diet full of cruciferous. That'd be my best recommendations.
Definitely. And you're basically touching on all the incredible supports that we can do in supporting our body's natural ability to detoxify. So our body just has this incredible ability of being able to detoxify on a regular basis. So you really were touching on a lot of the amazing supports for that.
Yes, that's the beauty of the human body. We are resilient. I mean, we've made it through so much in the span of human existence, and we can really overcome most challenges, especially things like toxins. And that's also the beauty of naturopathic medicine, like finding the root cause, trusting the body. We're not suppressing any symptoms. We're just going for removal of obstacles and stimulating the body's natural ability to heal.
I love it. I love it. Thank you for saying that. So, how would then somebody be able to support their immune system that might be getting affected by the fires? Like you mentioned some great supports in relation to supporting like detoxification pathways, but what would be maybe your top like 3 to 5 supports that you'd mentioned just that somebody can do now to help?
Number one, actually, and I've said this a bunch, but glutathione, right? It's a very strong antioxidant. It's going to boost our immune system. I see it happen all the time. It will also help get rid of the compounds. And then herbs that support white blood cells. So elderberry, echinacea. I love those herbs for immune boost. High doses of liposomal vitamin C, zinc, vitamin D. Even just getting out in the sun is good for your overall mood. Very underestimated, underrated. And, even getting your feet in some dirt, like get your electronic signal optimized, however you want to phrase it, but it would really help get your body into optimal vibration.
I love it. I love that. So going back to just like overall supporting our body with detoxification, who in this world like should be detoxing? Like, are there specific like people that you'd recommend for sure, like need this type of support, or is it everybody? Like, who would you kind of point to that needs the support?
I will say in general, everybody. But if we're going to target specific audiences, if you're working in a place that has, some sort of chemicals, if you're in a moldy house, if we're talking about conditions, definitely want to focus on women's health, like, and women, like, diseases like endometriosis, menstrual issues. Infertility is 1 in 5 now, and I've heard it's headed towards 1 in 3 couples. All this can really be prevented, all these diseases that manifest down the road, if we can support the body's ability to heal itself and get rid of these things that are carcinogenic and estrogenic in our bodies. So honestly, everybody, but people who are starting to manifest symptoms will benefit very strongly from detox.
So how would somebody be able to like orient themselves in a world that is sadly becoming more and more polluted every day, that's increasingly becoming more toxic? Like, how does somebody just like navigate their way like through this world and be able to come out on the other side like with their health and with their vibrancy?
Great question. I definitely went through this emotional processing having a kid, right? Like, oh, all the toxins, there's so many toxins in baby stuff, and just preparing for a baby, all the things that you get as gifts, and it is very overwhelming, and it can really be a frustrating situation, and you don't want to live your life in this gloom doom mentality. So what I do and what I tell patients to do too is, do what you can with reducing exposure and trust the body. Like, the body can handle it. Like I said earlier, we have livers. Livers are designed to filter things out. And yes, things are increasing as far as toxin burden on the body, but also our body is adapting just like we adapt through any other hard thing that's happened in human history. We will boost up our detox pathways and do the best we can to reduce toxins and sweat and exercise when we can. That's right, Freddie.
Ellen, that was amazing. Thank you for saying that. You have such a calming presence and way of being able to like state that so just with so much like vibrancy and just so confident that like we can make it through, which I personally really believe that too. Like, our bodies were made to be able to support us. And yeah, there are more pollutants, there are more things, but again, that's where knowledge is power, avoidance where we can, and supporting our bodies like through food, diet, sunshine, everything, water intake, exercise to be able to help. So I love that you've been touching on all that throughout this entire episode, because that's so important to keep reiterating, right? So I'd love to end with, if you have any other further, notes or things that you wanted to leave people with, and then where can people also find you and work with you if they would like that?
Great. Yeah, my last comment would just be that um, it's really important to believe in the body, like we talked about earlier, but also just know that we can be empowered to make our own decisions. You can decide what you do with your life. You can decide, where you're going and what you're exposed to. And when you can't, just be optimistic, like you said, and do the best you can. And detox when you can, really. Like, a yearly detox is what I recommend for most people, whether it's a water fast, whether you're going in and getting IVs, whatever it takes. But that really helps with longevity and reversal of chronic disease, and can really prevent trillions of dollars of healthcare if people just did one at least detox a year.
I love that. Yes, thank you.
And people can find me. I have a website that needs to be updated, but it's drellenmillard, .com. And then I have an Instagram, which I'm beginning to build on. It's been a bit of a journey, but it's also Dr. Ellen Millard, and a TikTok, Dr. Ellen Millard. But I have been posting, helpful detox tips and, daily life motivation things. So whatever alley you like to go through social media, I have a variety. And to book a visit, if that interests you, you can go on to my website, Dr. Ellen Millard, or the clinic I work for is wildoakmedicine.com.
Amazing. Well, thanks, Ellen. It was such a pleasure to interview you and gain so much knowledge from you regarding everything we talked about. I know this episode is going to be like super empowering and powerful for a lot of individuals, especially right now with what we're going through. So thank you.
Yeah, thank you so much. And thank you for letting me have my little Freddie here. I know he's been making a little noise, but he loves everything health and sound bowls and crystals. So he is very happy to be here as well.
Oh, just like his mama. All right. Thank you.
Thank you.